Hello my friends, welcome to the Life Buzz Daily. This is Lady Travel Solo. In the early days of the pandemic, Boris advocated on herd immunity instead of advising and taking preventive measures to contain the virus, the Wuhan virus or COVID-19 virus, even though major daily routines and people's lives may be disrupted. But all these measures should have been taken for the public good. Some of these restrictive measures include, for example, testing people, tracing contacts from the infected, instituting quarantines, banning mass gatherings, closing public spaces, advising about social distancing, etc., etc. So as an individual, you could do your own due diligence and follow these restrictive measures. So as an individual, you could also follow the guidelines I'm going to mention here to protect yourself as well as others in your community, such as, regular hand washing with soap water, use sanitizer, alcohol-based sanitizer, cover your mouth and nose when coughing and sneezing, wear a mask if going to public spaces, practice social distancing, and avoid close contact with individuals showing signs of respiratory illness. Avoid touching your face and disinfect frequently touch objects or surfaces. So if you show flu-like symptoms such as coughing, fever, shortness of breath, get yourself tested and self-isolate, stay home and rest. On March the 16th, Boris Johnson's strategy was not to track and trace contacts of every suspected case. Test only people who are admitted to hospitals, instead of being firm about social distancing. Boris Johnson offered soft advice only, such as people with symptoms should stay home, no school trips abroad. So the strategy was to focus on protecting the vulnerable groups such as the elderly, while other people would get sick like the younger age. This group like the younger age group, who would have milder illness and eventually recover to be immune to the virus. As a result, herd immunity would be developed and reduce transmission of the virus. That was his strategy and his thinking about using herd immunity to fight the virus, is to have the younger population develop that immunity, and as a result, it prevents the spread of the virus, as opposed to actually taking active and restrictive measures to prevent the spread of the virus before immunity is developed. But COVID-19 is highly contagious and deadly. The rate of the spread is much faster than the SARS virus. The contagious phase of the SARS virus only starts after the person shows symptoms, and therefore the person could be isolated. But for the COVID-19, this coronavirus is contagious before a person even shows symptoms. So you can get asymptomatic but infected individuals who can spread the disease in the community. In fact, you don't see symptoms in some of these infected individuals, and these individuals could infect others while hanging out in the public places before they get sick or not even getting sick and develop that immunity. So the only way to detect, especially the hidden virus in symptomless or asymptomatic individuals, is to do testing and tracing and quarantine these individuals before the disease could kill millions of people.